Hi, I'm Dr. Sharbell Hashoul, and today let's talk about breast cysts, one of the most common reasons people find a lump and worry it might be something serious. Here's the good news right away. Breast cysts are extremely common, and the vast majority are completely harmless. A cyst is simply a fluid-filled sac that forms inside breast tissue. Think of it a bit like a small water balloon sitting among the glands and tissue of the breast. They can show up in one breast or both, and you might have just one or several at a time. So why do they form? Breast tissue is naturally glandular, meaning it's made up of tiny lobules and ducts that produce and carry fluid, especially in response to hormonal changes. Sometimes a duct or gland gets a little blocked or dilated, and fluid collects there instead of draining normally. That fluid pocket is the cyst. This is closely tied to your hormonal cycle, which is why cysts are most common in women in their 30s, 40s, and 50s, often the years leading up to menopause when hormone levels are actively fluctuating. They can also change in size around your menstrual cycle, sometimes feeling larger or more tender right before your period. What does a cyst actually feel like? Often it feels like a smooth, round, movable lump. Some are soft, some feel firmer, almost like a grape or a small water-filled balloon. They can sometimes be tender or even a bit painful, particularly if they've grown quickly or are under pressure. Other times you might not feel anything at all, and a cyst is only found incidentally on a mammogram or ultrasound done for routine screening. Now, how do we actually know it's a cyst and not something else? This is where imaging is incredibly helpful. On a mammogram, a cyst might just look like a round or oval mass, but mammograms alone can't always tell a fluid-filled cyst apart from a solid lump. That's why ultrasound is the real go-to tool here. On ultrasound, a simple cyst has a very distinctive look. It's smooth-walled, round or oval, and appears black or dark because it's filled with fluid with a clear edge. When a cyst looks this classic and straightforward, we call it a simple cyst, and simple cysts are considered benign, meaning non-cancerous, essentially without question. Sometimes, though, an ultrasound shows something a little more complex. Maybe there's some internal debris, a thicker wall, or a small solid-looking component inside the fluid. These are sometimes called complicated or complex cysts. This doesn't mean cancer. It far more often reflects things like old blood products, inflammation, or thickened fluid. But because the picture isn't perfectly classic, your doctor may recommend a bit more follow-up, such as a repeat ultrasound in a few months, or occasionally a needle aspiration, where a thin needle is used to drain the fluid, both to relieve any discomfort and to look at the fluid itself. Speaking of aspiration, if a cyst is large, tender, or bothersome, draining it with a needle can provide quick relief, and it often shrinks down or disappears afterward. Though new cysts can form later in the same or different areas, that's just how these glands behave over time. If fluid is drained and it's clear or straw-colored, that's another reassuring sign. If it looks unusual, or if a lump doesn't fully go away after draining, your doctor might suggest sending that fluid for further testing, just to be thorough. So when should you actually be more concerned? A few things tend to prompt a closer look. A lump that feels hard rather than smooth and mobile, one that doesn't fluctuate with your cycle, skin changes over the area like dimpling or redness, a lump that keeps growing steadily, or an ultrasound that shows solid components rather than a straightforward fluid pocket. None of these automatically mean anything serious, but they're the kind of findings that deserve dedicated imaging and sometimes a biopsy to get a clear answer. Here's your practical takeaway. If you feel a new lump, don't panic, but don't ignore it either. Get it evaluated with a clinical breast exam and imaging, usually starting with an ultrasound. Most of the time it turns out to be a simple fluid-filled cyst that needs nothing more than reassurance or occasionally a quick drain if it's uncomfortable. Keep track of any changes with your menstrual cycle and mention that pattern to your doctor since it's a helpful clue. Breast cysts are one of the most common, most treatable, and least worrisome findings in breast imaging. As always, this video is meant to give you general understanding, not to diagnose or treat anything specific to you. So please talk to your own doctor about any lump, change, or imaging result you're experiencing personally. Thanks for watching and take care of yourself.